Hey everyone, it is Professor Lee, and this is the Medicine Procedures for CPT Coding Key Points lecture. So we begin with some of the basics for the medicine section of our CPT manual. Medicine procedures can be diagnostic or therapeutic. Diagnostic procedures help analyze a patient's complaint and determine the cause of signs and symptoms. It can include an assessment or an evaluation, an examination, and sometimes the use of equipment or tools that make a recording, like an EKG or an echocardiogram. And they are also used to conduct a function study. Therapeutic procedures treat a condition to minimize its effects, eliminate it, or to cure it. Therapeutic procedures classified in the medicine section include physical, pharmacologic, immunologic, mechanical, and mental techniques. So make sure you understand the difference between a diagnostic procedure and a therapeutic procedure. Medical term prefixes usually describe the method or technique used, whereas the suffix is going to describe the purpose of the procedure. So when you see these medical terms or the terminology used, be sure that you pay attention to the prefixes and suffixes. The prefixes will usually describe the method or technique, and the suffix is going to describe the purpose of the procedure. So moving on to the next section, manual sections. The CPT section for medicine provides procedures for 34 subsections, and those subsections are divided by the type of procedure, and they report non-invasive and minimally invasive procedures from a wide variety of medical specialties that are not appropriate for the surgery section. Because the medicine section lists codes from a wide range of medical specialties, diagnosis codes from nearly any chapter of the ICD-10-CM manual can be used to support these procedures. So as we talked about in previous lectures, you have to have a diagnostic code in order to accompany the procedural code. And so because this medicine section is so varied in the things that the specialties that it covers, you can use diagnosis codes from nearly any chapter of the ICD-10-CM manual to support a procedure code from the medicine section. Now, about those 34 subsections, it's important for you to read through those. They are listed in your textbook, they are listed in your CPT manual. I did not list them in this key point lecture to try to keep it brief, but there is additional information in your text and in the PowerPoint lecture for you to familiarize yourself with those 34 subsections. These are the subsections that are exclusive to medicine and will not be used in surgery. Many subsections and categories begin with special instructions that provide additional guidelines and instructions for reporting specific procedures. Frequent instructional notes in the tabular list identify which codes may and may not be reported together, as well as cross-references to related codes. It's important to pay attention to the notes and the cross-references as they are listed. Some procedures in this section are commonly performed as an integral part of a more extensive procedure. And so codes that are going to be identified with the note separate procedure should not be reported in addition to the more extensive service. So sometimes we will have a code that is similar to the code that you have found for a procedure, and it is part of a larger procedure code. And so in that case, we would only report the most extensive procedure and not the minimal procedure. You want to use such a code only when a procedure is performed at a distinct independent procedure, such as one performed during a different patient encounter, on a separate anatomic site, or not as part of another procedure. In this case, you would apply modifier 59 to alert the payer that you are reporting the code as a separate procedure. Okay, so we're going to move on to some abstracting rules that I want you to be aware of. Each medicine subsection has its own abstracting rules, with some subsections requiring multiple sets of abstracting criteria. It is incredibly important that you read those rules in order to make sure you are arriving at the correct code. Coders must be certain to thoroughly read those guidelines, special instructions, and instructional notes that appear throughout the medicine section to help guide you when you're assigning codes. And then lastly, you want to make sure that you follow the general CPT process for assigning codes. So index first, verify in the tabular list, notate any notes, and then select your code. The last section for this key points lecture is full of a number of things that I want you to know about. And again, there is additional information in your textbook that you should be reading to get extra information about the bullets that I'm highlighting here. But general rules that I would like for you to know about. When you are arranging codes for medicine procedures, you follow the general CPT sequencing rules as well. So there are some things that you need to remember when you are sequencing medicine codes. So the first procedure code should be one of the following based on payer requirements. It should be either a separate or unrelated E&M code, procedure most related to the principal or first listed diagnosis, or the third one is the procedure with the highest fee. So whichever is the first procedure code that you pick, it should be one of those three criteria, either a separate or unrelated E&M code, the procedure most related to the principal or first listed diagnosis, or the procedure with the highest fee. A note about E&M coding in the medicine section. To provide E&M services for medicine procedures, physicians may perform a general multi-system examination or a single organ system examination, depending on the nature of the problem being addressed. So sometimes they may do a full physical exam, or they could only examine, for instance, the integumentary system, so a person's skin if they're only having skin issues, or a person's eyes or their hearing or whatever it may be. So they could do multi-system and examine all of those things, or they could pick a single system, and that will be based on the nature of the problem being addressed. Lastly, and this is important to note for Medicare billing, the Medicare Physician Fee Schedule, or the MPFS, identifies codes that have professional and technical components. Now, you guys are learning to code out of the manual, so you're learning to manually code. But there are a ton of encoders, and to be quite honest with you, while it is incredibly important for you to learn to code out of the manual so that you know how to do it, there are a bunch of coding programs called encoders that oftentimes do the work that you are doing manually out of the CPT book or manual. The encoders do that work for you. And so most of the time the encoders are up to date with the Medicare Physician Fee Schedule, or that MPFS, and the encoder will provide the information for you about whether or not you can identify that that code has a professional or a technical component. So just something to keep in mind there. Now, there is an encoder available, I believe, to you at no additional charge in the MyLab section of your course, and I have to look into that a little bit further. I do not want you to use the encoder until we get later into the class, because one, I don't want you to pay for it if it's not free, and two, it's important that you learn how to look up these codes in the manuals physically. So if you have ventured in and dabbled with that encoder, leave it alone for now and focus on learning how to look them up in the book. Alright, y'all, that is it for the medicine procedures. This is a little less heavy than the E&M chapter from last week, but there is still quite a bit of information in here, so be sure you're reading your textbook and that you are reading through that PowerPoint lecture posted for you as well. Take care, everyone.